My name is Dr. Charlotte and I'm with Alpine Fit Physical Therapy in Boulder, Colorado. Today we're going to be going over some lumbar mobility exercises in the form of a pelvic tilt and a lumbar bent knee fallout. So we're going to start with the pelvic tilt. To do that, you're going to lay on your back with your knees bent. And then from here, I want you to imagine that you have a marble laying in your navel, and we are trying to move that marble down and then move that marble up. So as I do this, my hips are staying on the table. I'm not lifting up at all. I'm gonna try to tilt that marble down first into an anterior pelvic tilt. So my pelvis is gonna tip forward. My butt is staying on the table, but I'm arching my back, the small of my back, off the table. And then you're gonna tilt back, return to neutral, and then tilt that marble towards you. So we're gonna get a posterior pelvic tilt, flatten our back into the table, and then come back to neutral. And then from here, you can just go back and forth, tilting that marble back and forth from your belly button and shifting your pelvis anterior and posterior. This is gonna target the lower lumbar areas in our spine to get some mobility there. The next piece of our mobility for our lumbar spine is gonna be our bent knee fallout. So for this, we can go feet together, and then you're just gonna let your knees fall to the side, come back to the middle, and then down this way, and just back and forth. Since this isn't a core stabilizing activity, I don't want you to worry too much about your hip coming up off the table or not keeping your core tight. We're more worried about getting mobility in the back. So just kind of relax into this and go side to side, and this will work on that rotational mobility. If either of these hurt, just don't go as far, and then you're gonna do about 20 of the pelvic tilts and 20 of the bent knee fallouts.